Hello, everyone, and welcome to Arkansas Connections, the podcast bridging communities and resources statewide. The Arkansas Resource Hub is your source to HIV services, including testing, medical care, and supportive services for people living with HIV. Today, I am joined by Russell Rooms from Diversity Family Health, and we are going to discuss MPOX. But before we dive into today's topic, Russell, tell us a little bit about yourself and the work you do at Diversity Family Health.
Yeah, so again, my name is Russell Rooms, and I am a nurse practitioner with Diversity Family Health. In Arkansas, we have a couple locations, one in Little Rock and one currently in Hot Springs. And we are a primary care medical practice that focuses on providing a place free of discrimination and bias for all people to receive health care. And so we'll basically see anybody, but we specifically provide care for the LGBTQ community and the health needs that they have. We respond to. So that includes gender affirming hormone therapies, HIV prevention and treatment, women's health. So a lot of that work. We also have a walk-in clinic that is Monday through Friday, 9 to noon and we have same day results on our STI testing like gonorrhea, chlamydia, syphilis, those kind of things. We've been open for a little over 2 years now in the Arkansas area, and we're really excited to be here.
Well, we're excited to have a group like you in Arkansas because I know sometimes when it comes to discussing HIV or these STIs or even MPOX, it kind of, if you can kind of relate to the doctor you're seeing, nurse practitioner, it makes it a little more comfortable.
Yeah, we have providers that understand the culture or they're part of the community. So it's a great place to receive care where you don't have to worry about coming out to your doctor or discussing any aspects of your life because they'll care about you regardless.
Yeah. And no stigma. And
No
that's a big
stigma, no
one.
bias. Right.
All right. Well, in August, the World Health Organization declared MPOX a global public health emergency for the second time in 2 years. Can you discuss the current status of MPOX globally and locally?
Yeah, absolutely. So, we probably should kind of start off with kind of how we got here. And so, as you might remember, back in 2022 is when we had the first outbreak of MPOX, and where we had like over 100,000 cases reported in 100 different countries. The largest of those were like in Central and Western Africa, but as you know, we're a global community, so people travel, so it kind of quickly moves around the globe. So in 2022, we saw about 32,000 cases of mpox in the United States. 58 of those resulted in deaths. And in Arkansas, so back in 2022, we saw about 5 documented cases really in Arkansas. So really not a whole lot. But that was back in 2022. As of spring of this year, there's been a total of 82 confirmed cases in the state of Arkansas. The majority of those are in central Arkansas, like half of them are in Pulaski County, but then some others up in Fayetteville and over on the eastern border as well. But the issue is that these numbers may be low because, as we'll talk more about the virus, some people, if you won't report the infection, it'll just kind of go away in 14 to 21 days, or they might have even sought health care, but if the provider doesn't have it on their radar, then they might treat it like herpes or something else that will eventually go away. So why are we bringing this up now? Well, as you mentioned, the World Health Organization offered or declared a World Health emergency because of mpox and because we have a new strain. As we know, all organisms, they strive to survive, and so the virus is mutated to what's now called the clade 1 mpox virus. And so what we've learned is that is more infectious, and it's shown to be more deadly. So now in places like Africa, where we've seen the most cases, like 15,000 cases, and 500 of those have resulted in death. Those places don't have, they're poor countries, so they don't have the resources like vaccine and treatment and those kind of things. So we're not expecting to see anything like that here. But with this virus being more infectious, we're already seeing it in places like Sweden and Thailand, and so we're expecting it to, go through Asia and Europe, and then here to the United States. And like I said, this strain is more infectious, so it no longer really considered that sexually transmitted infection where you have to have this intimate sexual contact, but the virus can be spread kind of more casually.
Okay, you say more casually, is that just like if you brushed up against someone?
Right, and can even be transferred to devices. So the MPOX vesicle will have an exudate in it or like a little juice in it, and so you get
Mhm.
that juice, from let's say a pox that you had on your mouth or on your genital area or somewhere, and then you touch a door handle or you touch some silverware or a glass or something like that, and somebody comes around and touches that again, they'll get that exudate on their hands and then can put it somewhere on their body, like by touching their face or
Mhm.
something like that. So yes, it is more casually spread than intimate sexual contact.
Hmm. Which kind of makes it more dangerous because
Right,
always
it's
really
easier to
against
spread.
people.
It's
Hmm.
not spread through respiratory, but it is through contact with either an infected person and their hands or their body, or through secondary objects.
Now, with mpox, can you have mpox but not know it, like not show any symptoms?
Yeah, absolutely. Just because of the time frame that it takes to get MPOX, which is normally about 2 weeks, anywhere from 7 days to 2 weeks. So you could get it off of somebody else and pass it on to somebody else without ever knowing it.
What populations would you say are more vulnerable to mpox?
Well, so first of all, let me say that Mpox is just like every other sexually transmitted infection. They don't care about your sexual orientation or your gender identity. So everyone, regardless of your sexual orientation or gender identity, could be at risk. That said, men who have sex with men and some of their behaviors that they practice sometimes put them at greater risk.
Mhm.
But overall, you're at risk if you have close physical contact, of course, with any person that's infected, or have the contact with the bedding, clothing, or other objects or surfaces touched by that infected person. Um, if you have sex with multiple partners or go to group sex events, that where you have lots of physical contact, either sexual or otherwise, and then um, those people who have a weakened immune system,
Mhm.
like maybe people who have HIV that aren't on treatment or don't know their status. If you have eczema or some kind of disease that would cause there to be breaks in your skin, you would be more susceptible to it. Also, a thing they've seen in Western Africa, things like pregnancy and small children have more complicated or severe disease.
Are there any precautions, like, because it seems since it's a little bit easier to spell or spread, is there any like precautions we could take to kind of just decrease the spread of mpox?
Yeah. So, I mean, the first thing you should do is get vaccinated. I mean, that's the number one thing you can do to prevent getting mpox. If you do not want to get vaccinated, some of the things you can do is just basically understand that you're at risk and you kind of develop that kind of germophobia against the virus. And so know what makes you at risk. And that would be having sex with multiple partners at group events or coming in contact with somebody who would be at risk for those kind of things. Um, so no trying on underwear or harnesses or those kind of things. Be careful on the dance floor, kind of like brought up kind of casual contact that you could get on a dance floor. I don't want to make people scared of going out and having a good time, but just keeping that in mind. If you're not vaccinated, then if somebody has the exudate or the juices from smallpox on their arm and you have physical contact with them, you could get the virus. So again, just kind of develop that germophobia. Use like a paper towel to open doors at public bathrooms and those kind of things.
Is keeping Germex on hand good?
Yeah, absolutely. Oh, it's good hand washing and
I'm a Germex person. We'll go in the store, and as soon as we come out, I'm like, "Who wants Germex?" And I just go around squirting. Uh, Well, okay. Well, this is very good to know. So, if you do participate in activities like group sex or multiple partners, so now just go get your monkeypox or mpox vaccine, get you on some prep and some doxypep that I'm sure you can get at Diversity Family Health,
Absolutely. Yep.
and all those things will help protect you and help stop the spread. So, is there anything else you can think about that we should know about mpox and staying safe?
Well, I mean, I think we should talk more about the incubation period and about what it looks
Mhm.
like when you get monkeypox. Normally, the incubation period is about 7 to 14 days after the exposure. That's why we start seeing cases a couple weeks after, like Southern Decadence, Folsom Fest, Bear Weekends, that kind of stuff. So we kind of, keep track of those and talk about those, and hey, come see us for your evaluation afterwards. Um, but if you get exposed, normally about in 7 to 14 days, you may get what we call a prodrome, or what we kind of see before the rash, and it's that viral illness kind of symptoms like fever, malaise, fatigue, headaches, sometimes even like a sore throat or cough. But one of the main things we'll often see is what's called lymphadenopathy, or swollen lymph nodes, either in your neck, under your arms, or in your groin, either on one side or both. And so that's when the person is becoming contagious with the virus. Um, and again, they might go to an urgent care center or see their doctor, and their COVID's negative, their flu's negative, their strep is negative, but really testing for mpox without a rash is not readily available. So then we'll see the rash occur either with that prodrome, or after that prodrome, or without the prodrome. um, we'll see this rash develop, and that normally starts a few days into the illness, as kind of small flat spots, and then they evolve over a couple of weeks to become these fluid-filled bumps. Like
Mhm.
if you've ever had chicken pox, it'd be like that. So like little blisters, and then they get larger pus-filled blisters, and then they kind of break, and the fluid starts coming out of them and becomes easier to spread. Um, and so, really, until you're considered contagious until those scabs have dried and fallen off, um, and then you'd be considered no longer infectious. But it would be important, if you get those blisters, to come see us or go to your local health department, so that way they can monitor that, document the case, test for it to make sure that's what it is, and then can get you on treatment. Some of the more severe cases, there is a medication that we can give for it, but that's really kind of reserved for those severe cases where there may have a lot of pox or something around the mouth that may interrupt either eating or breathing or those kind of things. But normally the virus will clear on its own, and it's usually mild. Some people develop complications, but like pneumonias, or can have serious eye infections that would lead to vision loss. But again, most cases are very, very mild.
Little blister. Maybe just go see the doctor just to be safe if you've participated in a lot of the activities.
Absolutely. If you've had any activities that put you at risk for that, and you may even tell the healthcare provider, hey, I'm concerned that this is monkeypox or mpox, because otherwise they may not have it on their radar. Like I said, they're gonna say, oh, this is we've seen most commonly is that it's mistaken for herpes, because herpes will have those little lesions, or sometimes syphilis chancres. So you may go in and they go, oh yeah, that's herpes, and treat you for herpes, which is, and it's going to go away. They're going to give you the treatment for herpes, and in 14 to 21 days, it's going to go away. So, you would never know that wasn't exactly what it was.
If let's say you have monkeypox, what do you need to do? You need to isolate, stay home, or what does that look like?
Yeah. So if you think you've had monkeypox, and the first thing you should do is quarantine yourself for 14 to 21 days. And then during that time, get into either us or your local health department. Avoid close contact with any people, and if you have the rash, until those skin lesions are healed. Um, some of those other things like we used with COVID, like social distancing, and wearing a mask, so that way you won't touch your face. Number one, but number two, any of the secretions that you might have around your mouth don't get onto other people, and other people visiting you might also want to wear a mask as well. So if they touch something, they then won't touch their mouth, or something like that. Use separate bedrooms and bathrooms from others until the skin lesions have healed. Clean all the surfaces that you've touched. Don't share the eating utensils or towels or bedding with others. And another good thing would be to like increase the ventilation in your area, or use a HEPA filter or something like that to decrease the spread of the virus.
Yeah, the mask would be a good idea because you don't realize how much you touch your face throughout. Like there'll be times when I touch, I'm like, "Ooh, well, I shouldn't touch my face. I've just did this,"
Right, exactly.
and you don't really realize the things that we do in our daily lives. Well, thank you again for joining me today. And like I said, if you want to learn more about diversity family health or other resources in your area, go to the Arkansas Resource Hub and look at what resources are near you.
Thank you, Aaron. It's been my pleasure.
All right, thanks, Russell.